say whatever. You can say better. It's yeah. It's,
Oh, yeah.
oh,
No
oh,
problem. I'm gonna move this cup.
Just here.
Oh, is that thing cup too? Yeah. The surgeons, like, your mom doesn't live here, clean up after yourself. What's happening? Okay. Who do you want to introduce?
I'll just go. I'll just do, you do first, I'll do second.
Okay.
And then we'll just switch.
Yeah.
Okay.
John Ewing. Do you know who John Ewing is?
I do not.
Where's Advocate Health?
I think it's, someone said he's here.
Who? John Ewing. I don't know him. And Eliana.
The Oklahoma.
Yogunan. Good at pronouncing names. You should get the hard names.
I thought I did, but they put one of them, something's changed in the order because I had all the hard ones.
Did you?
I did.
All right, I'm just gonna give you the hard ones. We'll just go like, we don't even have to go in order.
Okay.
Which one? I'll get the Brian Jacob,
Okay.
John Ewing, and Jenny Shao.
Okay.
And then
Natalia and Knut.
Knut.
And okay.
I technically, being a foreigner myself, I should be able to pronounce the hard names, but you're doing way better at it than me.
Got you.
Good morning. What's up? How are you?
Mr. Passing. They kept us. Brian, how are you? I'm Chip Barnes. We've met in passing once or twice, and I missed you last year. You talked to Georgia Surgeon? Yeah. I never met that. Are you in Georgia? I am. So that's it. That's great. I was hoping. It seems like that meeting is really special. It's very down there. But it was really. I guess I didn't pick up on that. I never read this. I want to read. Oh, that thing. I think the people I was asking. Was it Davis? That's not bad down there. What time do we start now?
We can start now. Should we start now?
Yeah. This is going to be anything like that.
Because it's Saturday morning. Good morning, everyone. Thanks for being here on a Saturday morning. I'm sure it's not easy for most of you that were out last night. So we're going to get started. For our session this morning, Evolving Away from Halsted, Normalizing Health and Wellbeing in Surgery. My name is Talar Tajirian, and we have
Chip Barnes from Savannah.
Thank you all for being here. We're really excited about this session because it's really important to talk about our patients and about better patient care, but it's also really important to talk about how to take care of ourselves better. And the information about this that we can take away will make a great impact if we put the information into practice and know that we need to all think about our own health as much as we think about the health of our patients. Our first speaker is Brian Jacob. He's going to be speaking about the literature on this topic. Almost everyone here, I'm sure, knows Brian, but just to introduce him, he's an assistant clinical professor of surgery at Mount Sinai Hospital in New York City. He's the founder and CEO of the International Hernia Collaboration, and he serves on the AHS Board of Governors. Brian, thank you for being here.
Thank you, Jalar and Chip. It's great to be here. It's a topic that's important to me. Normalizing Health and Wellbeing in Surgery. The topic literature, and I didn't really know what to do with it. And so I just tried to figure out what story to tell you. And what I think is important is why this topic even matters. And it matters because it turns out that burnout is rampant. And if you look at the literature, 40 to 60% of us burn out at some point. And that is a huge, huge number. There's emotional detachment, mental fatigue, there's suicide ideation. And I treat a lot of patients who have the same thing, but it never dawned on me that a lot of us are going through it. And this is a photo of me with my shaman. And I think it's important for me to at least make you understand that I'm not just lecturing. I've actually been through this. I have hit rock bottom. I've been completely burnt out. This is from probably around 2017 or 2018, to the point where traditional methods weren't helping me, traditional therapy wasn't helping me, and I was at rock bottom. And not a lot of people know my whole story, but I was in trouble. And it was not until I really took a time out to do some deep diving into my own psyche to understand how I got where I was. And this is, remember, someone who's very successful, globally known. Everything's great on the surface, but inside I was really screaming. And so it's an important topic for me to teach you that burnout doesn't have an appearance, because you could, all of us, could be very, very happy on the outside, and on the inside you're screaming. What is burnout? I mean, this is sort of what I looked like when I was burnt out. That's me on the floor of an airport. But it's complete and really just thorough emotional exhaustion. You're completely emotionless. You're depersonalized, and you have you lose that sense of accomplishment. You lose the sense of joy in what you're doing. And while there's signs of burnout, you can sense headaches, and you may have a lot of irritable conversations, and little things will just start to bother you at home or at work. You'll feel like a little bit helpless. And you're just sort of going through the motions and walking through the path. As I mentioned, a lot of that sometimes doesn't even have an appearance, and so no one's going to know. Your OR techs aren't going to know. Your partners aren't going to know. But you're still suffering. And it starts to impact your entire system. Your sympathetics are on this flight or fight mode where you're starting to get indigestion. A lot of times the very first and subtle signs are that you get acid reflux or constipation. That's because your GI system is shutting down because your sympathetics are on overload, even in the unconscious. We store stress in different parts of our body. For those surgeons here that do a little spiritual work, you'll understand the term chakras. Chakras are places where there's 7 of them throughout the body, from the throat, the heart, the solar plexus, the sacral plexus, and our roots, where we store our stress. And so some people feel it hurting in their chest, or some people feel it hurting in their belly. Or their neck and their throat gets stiff. That's where you're storing your trauma and storing your stress. I always found it interesting. That's also where we get our hernias. I don't know if there's a correlation between that and the weakness we get in the actual abdominal wall. What impacts overall wellness and burnout at work? It's really just a part of the equation. And so at work specifically, there are a number of things that keep us in balance. On one side of the spectrum, to avoid burnout, there's this work intensity, and that's the whole part of your daily demand. And then to counterbalance that, there's something called appreciation. So there's acknowledgement of how great you're doing at work. There's the thank yous from your patients. There's the thank yous from your boss. And then there's the salary, right? So once your salary gets to a point where it actually makes sense to you for the work you're doing, that balances itself out if salary is important to you. But if salary is really, really low and your reimbursement's really low, whether we like it or not, that really impacts our burnout level. And then the other side of the equation is resilience and recovery, which is really the buzzwords for wellness and mindfulness. And then how do you make yourself happy, and how do you find joy? Are you doing that for yourself? And so this is the equation I came up with. This is the burnout equation, which incorporates work intensity, and then the 1 minus the salary plus 1 minus the appreciation divided by resilience and recovery. So this wellness factor, the resilience and recovery, are in the bottom of the equation, because as it goes up, the burnout level goes down. That number gets smaller. But as salary gets smaller, and again, there's an alpha in front of that. So if you look at the equation, if you don't weigh your salary as important, then make your alpha smaller. And if you think appreciation is more important, you can make your beta bigger. But either way, these things will impact inversely your burnout level. When you go home from work, make sure that you're looking at the 4 main pillars that make you whole. Starting with the top left, start with yourself. Make sure that you're doing the things that make you feel good, whether that's exercise, whether that's a hobby, whether that's meditation. Whatever that is for you, you have to carve out time for it and make it a priority every day or every week. Do not abandon yourself, because self-abandonment is the #1 quiet reason why we start to burn out. Then there are the parts of your family that make you happy. And if family is your trauma, stay away from them. But maybe there's a sibling that you're close with, parents, your partner, your children. Make sure that connection is there second. Once that's done, then you can move on to friends and work, right? Because if you don't take care of yourself first, the other things are just going to start to become a false identity and something that's not ultimately going to make you happy if they take it away. So in other words, if you're really married to your job and you lose your job and you don't have anything else, you're going to have burnout. For me, it's music, EDM. I make it a point at least once a month, if not twice, to make it to a known DJ. I dance. I'll dance for 3 hours. This is me with a DJ named Sebastian Leger. And this is my hobby. And people are like, oh, you're too old to go to these discos and these dances. No, you're not. For me, it's therapy. And I happen to just love being there. I love the vibe. And when I come home the next day, I just feel completely ready for the work. Appreciation. Okay. Appreciation at work. You know, you may not get it.
It is my distinct pleasure to introduce the Golden Consult Award to our own emergency physician. Congratulations, sir.
You know, you all get awards, and sometimes that's enough for you, right? Getting the award is fulfillment. That's not true for everybody, but make sure you're getting a little bit of appreciation at work. And so with the last 3 minutes, what works? What evidence-based interventions have been proven to help people avoid burnout and improve wellness? Mindfulness programs, peer support, protected time for reflection of the things I taught you about. Things like at the college that they're working on, they have a well-being index, which I'm not going to dive into. They could give a whole talk on that, but they have a whole surgeon well-being protocol. You can actually calculate if you're doing well. They have something called the second victim, where if you feel like you're really stressed out at work or a patient's bothering you, you can go there and get some therapy and some help at the surgeon well-being level. Thanks to Dr. Tajirian, Talar helped us implicate even at meetings, surgeon wellness. At every IHC meeting, we've had a surgeon wellness section where you could be sitting at a lecture like this, walk outside in the back, get some acupuncture, get some Pilates, and then come back to the lecture. So you're taking care of yourself and body, as well as taking care of your mind at the same time. So I think surgeon wellness is very important, or just wellness for us in general. Then the next buzzword is resilience. Resilience is not what you think. Like, to me, it was like gritting and like sucking it up and taking whatever they give you. But actually, it's quite the opposite. It's actually self-reflection. It's the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And if you look at the circle diagram, you really have to start with focusing on yourself, and you have to be clear to yourself about what you need and value, both professionally and personally. And once you have that, you need to cultivate insight and awareness, self-reflection of, am I being true to myself and giving myself what I need to thrive? Then you have to actually act on that. You have to actually take care of yourself and make sure you're taking care of yourself thoroughly. And if you're not, seek out support. Find someone that can help you, whether that's a partner or a therapist or someone who's been through it, because we don't talk about this enough. There's shame and there's guilt around the problems we're having. And I think less today than it used to be 10 years ago. I think it's safe to start talking about it. Yes, there's literature that shows resilience works, especially in residency programs and in surgery programs. But more important than not is just talking about it. We're going to hear different lectures coming up next about these different programs and about mindfulness. I'm not going to get into that. At our hospital, we've implemented something called the weekly pause. They'll send out a text. You click on it, and it gives you a 7-minute meditation that you can actually listen to. They send it to the entire department, all the residents. And it's a really nice way that our hospital is embracing mindfulness, is just to take this pause and do some meditating. Despite that, there's papers that show it's not enough. It becomes individualized. Despite these things, people still have burnout, and you need to make sure that you're being mindful of that. These are just some of the things you can do to take care of yourself if you're reaching that point. Acupuncture, cupping, zero balancing, yoga, Pilates, physical therapy, sound baths, to sit and listen to soothing music. This is my friend Max. He just runs this amazing sound bath. You just sort of immerse yourself in it. When you come out, you're actually feeling better. Things like Reiki, Kundalini, there's float tanks. There's lots of things out there to help you. But break the culture by talking. And I'm going to skip the stuff on PTSD and ruminating, but just understand that there's help. If you're really, really suffering, there's help, and there's people that can direct you to the right medicines, the right therapy. Some of the stuff that used to be legal is trying to become illegal, is trying to become legal, like ecstasy and MDMA has 2 randomized post-active trials that showed its safety, and it actually can help people with very severe PTSD. Unfortunately, FDA was really optimistic about or thinking about making it legal. They just recently rejected it, and now we're set that back, so PTSD is going to have to take a little while. Closing message, the literature is clear. Caring for patients begins with caring for ourselves. Take care of yourself, take care of your family, and you can avoid burnout. Thank you very much. And if you have questions and you want to talk about your story, just email me and I'll talk to you about whatever you're going through.
Brian, that was fantastic. Thank you. I'd like to thank him for being so open about his struggles. I certainly can relate to it, and I imagine whether everyone wants to admit it or not in this room, that everyone in this room can as well. Next up, we've got Natalia Pascotini Pereira from Brazil. She's a general surgeon there and a rising star in the hernia world, and she's going to talk about nutrition.
Thank you so much, AJS and the board, for inviting me. It's a truly honor to be here, and also a challenge to talk about such a relevant but unusual topic to a hernia meeting. So these are my disclosures, and the reference that I use are on this QR code. So all we know what is a healthy or unhealthy diet, right? Most of us think diet it's only about weight, diabetes, hypertension, but in fact, a diet can affect all of these, from cognition and fatigue to immunity and cancer. So how the food impacts us? When we eat unhealthy food, we triggers our gut microbiota to dysbiosis. This triggers inflammation and activates 3 pathways: our immune, endocrine, and neuronal pathway. So our gut microbiota communicates to our brain, shaping our appetite, cognition, even depression risk. And eating unhealthy food leads us to health problems like obesity, diabetes, but can impact negatively to cognition and mental health, like anxiety, depression, even cognitive decline. So why are we eating so poorly? We are facing a global shift to ultra-processed food. To understand that, we are going to talk about the ultra-processed food itself. They are delicious, tasty, but they are linked to over 30 health problems. They are not just empty calories. And when you are looked to this graph, 58% of the daily intake of the calories of an American comes from ultra-processed food. The problem is not the ultra-processed food itself, but when our diet is dominated by it. This leads to conditions that we all know, like obesity. And obesity is not just BMI. It's not just how much fat, but where the fat is and the clinical impact that this can cause. So even people with normal BMI, maybe just overweight, can have the same health conditions of a clinical obesity, like fatty liver, high cholesterol, insulin resistance. And this is clinical obesity. It's not just BMI. As surgeons, we often neglect our well-being and nutrition due to our job demands. So less than 40% of healthcare professionals consider their dietary habits very good, and 85% fail to meet the recommended vegetable intake. Eating unhealthy food can lead us to burnout. So burnout is not just overload. This high processed food intake and caffeine can do that. And our environment explains part of the problem. So in hospitals, what do we find? Ultra-processed snacks like chips, sodas, sugary cereal. We never see like fruits, oats, or protein. So this limited access to healthy food impacts in our dietary choices. We work on exhausting schedules, and this contributes to unplanned and unhealthy meals. Chronic stress increase the consumption of these rare foods, so this is a vicious cycle. Of course, knowing about nutrition, it's not sufficient. We have to change our habits and change our environment to eat healthy. This first graph, it's the trends, the obesity trends from 75 to 2016. As you can see, obesity is rising in every region, but Americas are leading the list. And looking for our own profession, which physicians do you think are most overweight? General surgery are leading the statistics. So nutrition is not just a long-term health, it is performance. It's a cognitive performance too. In these first two papers here, they are trials, and they made dietary changes in physicians and trainees. So eating the right food at the right time improved their attention, faster reaction time, improved mood, reduced fatigue and sleepiness, and better short-term memory. So it's beyond these two trials. All the data are pointing at the same direction. Eating unhealthy food leads us to health problems like burnout symptoms, lower our well-being, and even frailty risk, and even in younger surgeons. So if nutrition affects our performance, imagine what can do for our patient safety. Eating unhealthy food reduces our focus and lower our physical capacity. This means that this potentially can increase mistakes and less effective lower delivery care. Our institutions has responsibility on that because it's not just only a personal choice. So they need to support and to improve the access of healthy food, break this cultural shift where doctors just work and don't eat healthy, and implement nutritional breaks. This is a great thing that Victorian government from Australia did in health in hospitals. They tag food. So the idea is simple: make the healthy choice the easy choice. So the green one is the best choice, is super healthy food. They are always promoted, always available in meals and snacks. The amber is choose carefully. These foods, they have some nutritional value, but they are moderate in fat and sugar, and they don't dominate the menus. The red one is the ultra processed food, so limit. They are not promoted at all. This is a simple strategy and impactful in our environment that can change our dietary habits. Of course, we cannot keep blaming only our institutions. We are grown-ups, so we can plan our dietary changes and dietary habits. Like if we are running on a long shift, personal plan. We can bring rich protein snacks, prepare our nutrition meals in advance. And as surgeons, we know a lot of things, but we don't know everything, especially about nutrition. We can ask support and consult with endocrinologists and dietitians so they can help us to plan our meals and check exams to check if everything is okay with our health. We can use technology in our in our favor. Like we have a lot of apps to track and to help us to drink or eat properly. And we can use the CGMs just to be aware that the glucose peaks that we have can impact in our mood, in our sleep, and in our performance. And we can talk to our institutions. They have to know that we know that this unhealthy food, impact in our performance. So we can help them to create healthy menus or ask them to have access to this healthy food in hospitals, cafeterias. So as the air mask analogy, put your own mask first. We have to be well fed to care for others. It's not about being perfect with diet or obsessive with it, but it's about being conscious that these choices can impact in every part of our lives. Thank you.
You can, yeah, we'll have we'll have a Q&A session at the end after all our speakers. Next, we have Dr. John Ewing. Dr. Ewing is a general surgeon at Advocate Health in Charlotte, North Carolina, and he will be talking today about sleep, probably something that none of us are getting in these few days.
Thank you for the introduction, and thank you to the AHS for making space for this session today and for the opportunity for me to discuss this topic. I recently finished my fellowship at Carolinas Medical Center in Charlotte, North Carolina, and this month I'm excited to start my practice here at Vanderbilt University here in Nashville. I've titled my talk today, Don't Sleep on Sleep, because as many of you would attest, among health and well-being topics, sleep can be easily overlooked. Improving sleep habits isn't easy, and it can feel out of our control due to patient workload and other care responsibilities. I have no disclosures, but I do want to mention that I'm not trained in sleep medicine or sleep research. As I was preparing for this talk, I reflected on how my perspective on wellness has changed over the years, and something came to mind that one of my chief residents told me about halfway through residency. He was actually talking to our whole residency program, and I had been framing wellness as something that occurred outside of the hospital, opposite of work. It happened automatically when we had space to rest and recharge. But really, wellness is an active process. It means being intentional about developing habits that support resilience and prepare us to perform at our best. And so I'll talk about how sleep is a part of that. We'll cover 3 objectives. Why is sleep important? What happens while we sleep? And how can we achieve optimal sleep? Sleep is important both with regards to its impact on acute performance as well as its long-term health effects. Aviators and truck drivers have professional mandates limiting working times without sleep. The effects of sleep on reaction time and driving performance are well known. This Scottish study tested 30 subjects in a driving simulation in 3 conditions: fully rested, sleep deprived, and intoxicated above the legal limit. Lane tracking, braking reaction, and lane changing times were all more impaired from sleep deprivation relative to intoxication. And interestingly, caffeine actually didn't counteract this effect despite participants feeling more alert. You may be familiar with these or similar findings, but this comparison to alcohol remains profound, especially when you consider extrapolating these findings to much more complex motor and cognitive tasks like those that we perform as surgeons. However, there's a positive side to the discussion around sleep too. From studies on athlete performance, we can see that healthy, adequate sleep is almost like a cheat code or a performance enhancer. After a 5 to 7 week sleep extension period, collegiate basketball players were demonstrated to have statistical significant improvement in free throw accuracy, field goal accuracy, reaction times, and sprint times. Similarly, collegiate tennis players serving accuracy into a 6-foot service target, one that I would be missing 95% of the time, increased from 36 to 42% after a sleep extension period. So how does this affect surgeons? Several studies have examined the effect of sleep on surgeons that have shown that this is a common problem. I don't think we need studies to show us that, but one study showed that acute care surgeons met criteria for sleep deprivation on 65% of nights or more. And these naturally encountered levels of sleep deprivation do affect performance on simulated technical tasks. This is a difficult topic to study. Much of the literature revolves around trainees. So I wanted to highlight this one study that was unique in that it prospectively observed attending surgeons in the operating room in pre and post-call cases. This was performed at 8 Boston area hospitals with 60 surgeons who were observed in multiple cases, up to 5 apiece. And herniorrhaphy was actually the second most commonly performed case in the study. So out of 362 cases, 150 were post-call. Sleep was expectedly shorter in post-call cases, 5 hours versus nearly 7 hours. There was no difference in task errors based on an in-person observing physician researcher, surgeon report, and based on chart review. There was a trend towards longer operative times only when the surgeon perceived that he was fatigued, he or she was fatigued. And so there was some hypothesis that a slower pace may compensate for errors. But interestingly, the human factors expert observer scored surgeons on a structured non-technical surgical skills, or NOTSS domains. As this graph shows, the percentage of surgeons receiving good or better NOTSS scores in the post-call state was worse by a statistically significant margin for situational awareness, decision-making, and communication. So clearly, even in the operating room, we need good sleep to be at our best. Sleep also affects long-term health outcomes. We talk about pre-optimizing our patients. We should be thinking about these factors for ourselves too. So as you can see, this meta-analysis, which included 11 studies and over 18,000 patients, demonstrates that sleep duration is associated with an increased risk of type 2 diabetes and a U-shaped distribution, with both abnormally long and short sleep conferring a higher risk. There's evidence of the metabolic factors that underpin this. Decreased sleep causes physiologic changes that lead to metabolic dysfunction. There's increased cortisol levels and catecholamines with sleep restriction. Insulin sensitivity is decreased. Fasting insulin levels are higher after just one night of sleep of less than 4 to 5 hours. Poor sleep quality, not just duration. So when deep sleep specifically is disrupted, glucose tolerance test results actually falter. Population-based studies supports this too, as we see increase in risk for obesity, fasting glucose levels, and rates of hypertension. Finally, and perhaps most importantly, is the effect on brain health. In the Journal of Stroke, the American Heart Association issued a summary on the impact of disturbed sleep on brain health. Short sleep, less than 6 hours, was associated with an increased stroke risk. Sleep apnea was one of the most profound factors, increasing stroke risk by 2-fold. And short sleep was also associated with an increased risk of dementia. So what happens while we sleep? There are 2 phases of sleep. You may be familiar with non-REM sleep and REM sleep. Non-REM sleep is characterized by low muscle tone, minimal psychologic activity, and an increasing arousal threshold as we descend into deeper levels of non-REM sleep. These are characterized by slow synchronous EEG waves, and this is a really important phase of sleep. This accounts for hormone regulation, metabolic waste clearance, immune health, and this is specifically decreased with sleep fragmentation. The glymphatic system is most active in this phase of sleep. That's our brain's waste disposal, which helps clear interstitial debris by increasing CSF flow through perivascular channels. REM sleep, or REM sleep, is also important. The EEG of REM sleep looks almost identical to our awake state, but our spinal muscles are atonic. Dreaming occurs in this phase of sleep, and it's important for memory formation, emotional regulation, and disruption is associated with depression. Here you can see the normal progression of sleep over the course of the night. We start in non-REM sleep, descend into deep sleep, and then REM sleep. This occurs in about 80 to 90-minute cycles, with an increase in the duration of REM sleep and decrease in the duration of deep sleep. So what can we do to achieve optimal sleep? What strategies and tools do we have? The first is being intentional about our sleep environment. Darkness is key. Sleep experts say that we shouldn't be able to see our hand in front of our face. Be thoughtful about putting up blackout curtains to block external light, removing electronic lights, and turning off or turning away blocking alarm clocks, which can also create anxiety by telling you, what time it is in the middle of the night, disrupting your sleep. A cool temperature is ideal to support our body's natural diurnal temperature variations. And I was surprised to learn that ideally our sleeping environment should be about 65 degrees Fahrenheit. A warm shower or sauna before bedtime can increase the blood flow to our skin and help us cool our core body temperatures and also support this variation. Alcohol and caffeine are important topics, and we could talk at length about these. The bottom line is that alcohol interferes profoundly with normal sleep architecture, particularly REM sleep. Other substances do as well, including many of the sleep aids that our patients receive, with really trazodone being one of the only ones that's especially benign. Caffeine's important too. So caffeine blocks the receptor for adenosine, which accumulates throughout the day to create sleep pressure. and keeps us from sleeping. The half-life is up to 6 hours, so a double shot of espresso around 3 p.m., which on a long day to me doesn't seem very abnormal at all, is like drinking a cup of coffee at 9 p.m. Sleep habits that are important are developing a bedtime routine, a consistent wake time, enough time to sleep, and then avoiding interactive or stressful stimuli in the 1 to 2 hours before bed. This one I think is especially difficult for me, and I'm sure many of our audience members as well. Reading a book or a TV show has been shown to be less disruptive than scrolling, social media, email, other more interactive tasks that are more stimulating. And most importantly, I think strengthening the sleep equals bed association by keeping the cell phone and tablet away from our sleep environment. This slide summarizes the optimal sleep duration, which we've touched on a little bit before. The bottom line is our moms were right. About 8 hours is what we need, even if it seems like we can get away with less. Regular exercise and sunlight exposure can help support our natural circadian rhythm and develop sleep pressure. So in conclusion, sleep deprivation has serious consequences. It impairs our reaction time. It results in worse athletic performance and decision-making and can impact our performance in the OR. Long-term, helpful sleep is important to lower our risk of type 2 diabetes and other metabolic dysfunction, cardiovascular risk, and support our brain health. And non-REM and REM sleep both have specific benefits. So anything we can do to develop an environment and routine to support quality sleep is important. Thank you for the opportunity to share this with you all.
John, thank you for that. Next up, we have Knut Bort from University Hospital in North Norway, who will be speaking about exercise.
Thank you, dear committee. I hope you're not too sleepy, because now we'll talk about exercise. So I'll tell you a story. I used to be a professional athlete. I trained 2 or 3 times a day from I was 16 till I was 28. The highlight of my career was sitting in the office of Arsene Wenger in Arsenal Football Club because he needed a new goalkeeper for his Premier League team. And I had tremendous amount of injuries. So this is a picture after I tore my left fibular tendon. After this, I became a surgeon. And as most of you, I have an extremely busy life with huge abdominal reconstructions in the OR. Travel to congresses like this, enjoy parties with alcohol and little sleep, and I have a wonderful family. So my schedule is very, very busy. And the consequence of an unbalanced life, as a surgeon easily can have, is that I went from being super fit to what my kids call the whale. So my belly started hanging above my waistline. And I experienced very interesting effects of this life without exercise. My weight increased, my blood workup showed the metabolic syndrome was getting even closer. I started having sleep apnea, constant fatigue, so tired, low-grade inflammation in my joints after surgeries, and I started to feel that my psychological resilience was also deteriorating. Even my memory got worse. And I started to be indifferent to my own health. I once told my kids this incredible stupid comment that I think I've trained enough in my life. My dear darling bought me a health ring, which showed that I was 10 years older than my biological age. And then I got an invitation to speak for you today about exercise. This was in May. And it was my wonderful friend Vedra who gave me this invitation, because I think Vedra had seen my decline from the first time we met in 2017. And when we're talking about exercise, there are 3 main exercise types from the intensity we do it. We have the middle intensity, which is continuous, where we exercise 60 to 80% of our maximum heart rate. Then we have the high intensity interval training, where you go between 80 and 95, and what's called sit, which is the sprint intensity, where you go flat out for very short periods of time. And as a surgeon, HIIT would be probably the thing for me because I don't have much time. And it has shown a great effect on weight loss. And this is a comparison study between HIIT and MICT, where they show that both types of exercise will reduce your waist circumference. But the key is that the HIIT group did it with spending 40% less time. This is another study comparing the same, but on body fat reduction. So 40 college students, average BMI of 29, 8 weeks program. The HIIT guys did 28 minutes training sessions. The medium intensity did it almost the same time, but you can see that there is a tremendous difference in the loss of fat loss. There have been done meta-analysis on this, showing that HIIT is very efficient for reducing especially the visceral fat, which is attributed probably to the catamine activation of the abundant beta-adrenal receptors in the visceral adipose tissue. So if it's good to go harder than medium intensity, why not go for sprint interval training? This is an interesting study done by a university in northern Norway. They have developed the recipe for the Ingebrigtsen brothers, who are now the world's best sprinters. And they did some trials on sprint interval training. But as you can see from this PhD thesis, that 13 out of the 17 subjects who were submitted to sprint interval training got injured, started vomiting. So it might not be a very comfortable training method. So Bruce Lee, he said, long-term consistency beats short-term intensity. So if you're gonna work out, find something that you can be consistent in. An interesting study from Finland shows functional MRIs after physical exercise. And it's well known that we get endogenous opioids release from training. This study shows that if you increase the intensity to near sprint interval training, you will also activate centers of your brain that is responsible for pain and discomfort and anxiety. So it might be an effect of training too hard that you actually don't feel well. So what is HIIT? It was described in 1948. First time, it contains a short burst of activity from 15 seconds to 4 minutes. You have to do it really hard. You have brief recovery periods in between, and you do it for 15 to 30 minutes. When we talk about strength, muscle strength, we can look at Arnold, who did 150 kilos bench press. But when we talk about the cardiovascular system, strength is the VO2 max. And VO2 max is a formula dependent on the cardiac output and how much oxygen we can consume, our body can consume per minute. And HIIT has a great effect on the cardiovascular strength. It increases our left ventricle thickness, it increases the stroke volume, increases maximal cardiac output, it reduces the stiffness in our arteries by nitric oxide release. And it also has a tremendous effect on our mitochondria. So when we do HIIT regularly, we have an increase in the number of mitochondria and also the size of them. So here you can see an electron microscope image before and after this kind of training program. It's very interesting what happened to lactate. When I studied, lactate was a waste product from anaerobic metabolism. But in 2009, they coined this term called lacthormone, because lactate is probably a more profound signaling molecule than we had understood. So it stimulates angiogenesis and epithelial cell migration, which helps wound healing. It stimulates myogenesis to increase muscle fibers. It proliferates the mitochondrial reticulum, as we spoke about. It even alters our genes. And it increases the number of glucose transporters so that we have better insulin sensitivity. And to me, I love candy. So I'm very glad that there is a huge reduction in my sugar cravings after these kind of exercises. What's fascinating is also the cognitive effect of this kind of training. So lactate can cross the blood-brain barrier, and it can make the neurons secrete what is called brain-derived neurotropic factor. And this signaling molecule is called the fertilizer of the brain. And there are several studies that show that HIIT training increases your cognition and your memory and your learning abilities. So what did I do? I downloaded an app for HIIT training. This is just one of many available apps for you if you want to try this. It's called Freeletics. It gives you a training plan. They show you the exercise. It's a warm-up and it's a main training session, and then it's a cool down. And I chose body weights because my experience from my sports was that if I lifted heavy weights, I got injured all the time. So this is how it looks using my 120 kilos to try to replicate what they do. And this app also has a progressive difficulty. So as I hopefully become more fit, I will be able to do burpee hang-ups. That would be a nice goal to do. For surgeons, it's important to have core stability and mobility. So there's also a lot of exercises covering that. And it's very fun to see your prior performances. You can see that you actually do things faster and you get stronger. You get points, you get claps. There is a community where you can get claps from your friends. You have data on your consistency, and you also get a score for your performances. So I wish this will be me in a few months. I've started my journey. I've lost 5 kilos in 2 months. I feel so much better. And I can give you some advice when you want to go home and start something like this. So I recommend you to set a goal. My goal was coming here. That was my start. Thank you, Vedra, for that. Put your aim on the fridge so you don't forget it. Find an app or program you like. Plan your start. Don't start just before you have some very busy weeks ahead. And get a partner. It's always much more fun to do things together. I started with my children back home, and when I came to visit Conrad, we also went to the gym also almost every day. And especially the first 4 weeks are key, because that's when you'll struggle the most. Stay motivated by using videos or books. David Goggins is amazing when it comes to creating a tough mind. And don't be afraid of the lactate. Go chase it. It's an amazing signaling molecule. You can combine this with intermittent fasting for more efficient weight loss. Give yourself 4 weeks before you look in the mirror and look for a change. It takes a bit of time to get used to it. And don't compare to Instagram or other guys in the gym. Compare only to yourself and spoil yourself when you reach minor goals. Thank you.
Knut, thank you for that. Another low point that an admission that I can relate to. Next, we're going to have mindfulness from Iliano Geogleman from the United Kingdom. I think we have the wrong presentation up. If we could switch it, please.
Good morning, everyone. My name is Ilana Jogluman. I'm a consultant surgeon in UK. It's a real privilege to talk to you about mindfulness. Now in terms of disclosures, I don't have any financial disclosures related to this presentation, but also I would like to say that I'm not a trained mindfulness teacher or a trained life coach or anything like that. But mindfulness has given me in the last 3 years the light at the end of the tunnel for my career. All of us are parents, friends. All of us have people that we need to care of. You have that morning, wake up at 5 o'clock, 6 o'clock, where you start rushing, getting your children ready for school. Your little one, 8-year-old, is throwing a tantrum that he doesn't want those shoes. Your 13-year-old shuts the door in front of you that she wants to get her short skirt at school. And you just rush all over the place. Your adrenaline, your cortisol levels are high. You finally get into the car and you see that your petrol tank is about 10%. You pray yourself to drop the kids to the school, to be able to reach to your operating theater where you have 2 abdominal wall reconstructions. You finally manage to get your kids to the school after getting the traffic light twice because the lady in the red Ferrari was trying to put the lipstick on. And finally, you manage to reach with that 10% to hospital. Your favorite parking slot is occupied. You get changed into scrubs, and then you get to theater, where that's where you
Begin
need to be
by finding a
focused.
quiet space where you can sit comfortably for a few minutes. Close your eyes if that is okay for you. Sitting here, eyes closed, in the stillness of the surgical room. Maybe the sound of beeping machines and gentle hum of the ventilation system creates a soothing melody that helps you focus, and the mind begins to quiet. Like the surface of a lake on a windless day.
That was quite calming, no? And this is why mindfulness matters in surgery. We work in a high-stakes environment with high level of stress. There is cognitive overload that leads to emotional fatigue, medical errors, which lead finally to burnout, as my colleagues have previously mentioned. And mindfulness is a tool for us to sharpen our attention, our resilience, but also empathy towards our colleagues and patients. What is actually mindfulness? Mindfulness is a grounding technique, paying attention on purpose to the present moment in a non-judgmental way of your feelings, your thoughts, and sensations. It is a simple practice that has deep roots in the neuroscience and behavior health. It is not about zoning out or detachment, it is about living in the present moment. What are the benefits of mindfulness? First of all, improvement in focus for all of us, intraoperative awareness of what is happening actually in that environment. It gives us emotional regulation and sharpens the decision-making, reduces the anxiety and the burnout. If you reach that stage where you're calm, you can handle the situation well, you can communicate sharply with your team, sharply in terms of clear, respectful, that will strengthen the team communication and leadership. And when you reach after that hectic morning in theaters, you will finally have your calm moment, your peaceful place where you love to be as a surgeon. What is the effect of mindfulness over our brain? First of all, our prefrontal cortex gives us a better executive function, better decision-making. Our amygdala reactivity, if you're used to the little chimp, the chimp paradox, amygdala is calmer and respond in terms of response to stress. In terms of insular cortex activation, gives us an improved empathy and body awareness. This is why in practicing mindfulness, brain scan and understanding and naming your emotions is very important. Common challenges that we face as surgeons are time pressure, sleep deprivation, conflict within the teams, difficult cases, difficult outcomes. And mindfulness help us to create a pause before a reaction in a difficult situation. How we can include mindfulness in our practice. 2 minutes breathing exercise between cases, thinking of 3 seconds breathing in, 3 seconds holding, and 6 seconds breathing out. Body scan while scrubbing. Theoretically should be about 2 minutes while we spend on scrubbing in. During that period of time, we can do our body scan starting from top to bottom. a silent moment before knives to skin. And once we finish the operation, it's a reflective journaling while we're typing our op notes. We basically go step by step through what has happened in theater while we operated. And at the end of the day, when you leave the hospital, finally planning to go home, have just a gratitude moment where you can check in and be happy and content for how the day went and thinking on how you helped people, how you supported your colleagues. As mentioned before, mindfulness techniques in the operating room, 3 breaths before incision, practicing box breathing or stop technique before doing anything. Stop, take a deep breath, observe, breathe out, and start. We have key moments during our operations, main steps that we need to follow. After each of those steps, give yourself 30 seconds to recheck with yourselves, recheck your feelings, recheck your state, and proceed for the next step. As a mindful surgeon, this cultivates psychological safety within the team that reduces the reactivity to perceived criticism, as there is better communication between yourself and your anesthetist, your scrub nurses, your ODP, your colleagues. Enhances active listening, and that's powerful for team dynamics. And also, as a leader, supports empathy-based leadership. There is scientific evidence, and here we have 3 of the US-based studies on residents related to practicing mindfulness that have showed improved cognitive and cortisol level, reduced stress for the residents, and better technical skills for them. The same is reflected on the effect of practicing mindfulness on surgeons, attendees, and head of the departments as well. The evidence also reflects on 30% decreased surgical error for surgeons who are practicing mindfulness. And the most important thing is just having practicing mindfulness. It's linked to improved patient satisfaction and lowering cortisol levels for the surgeons. We often find lots of excuses in avoiding practicing mindfulness. I don't have time. This is too soft for me. I'll lose my edge. But actually, mindfulness helps you to sharpen your edge. Bring it as a small habit with compound effect in time. Set intention every morning to try to practice mindfulness. Use the scrub time. Reflect for 2 minutes after the operation. During your lunch breaks or during your breaks, try to have mindful eating during your breaks, for example, and encourage a mindful culture within your team. There are apps. Yeah, we all like a good app, but also there are books we can read about mindfulness. And it's just, as I said before, start with just 2 minutes a day and then build up in your daily activities. There is guided 2-minute breathing session, and starting with closing your eyes, being in a comfortable position, feet grounded, and remember the breathing exercise. 3 seconds, take a deep breath in, hold it for 3, and 6 seconds, breathe out. You start noticing your body sensations, the sounds around yourself, and your thoughts. It's very important also to name your feelings and acknowledge them. And then gradually, after 2 minutes, you just return to your normal breathing. The takeaway messages are that mindfulness is not a luxury, is a skill, is a soft skill that all of us should have. And small practices make big difference in your life. You can be also a high performer, but also a centered person. Thank you. Any questions on the QR code?
Thank you, Ileana. Next, we have Dr. Jenny Shao. She's going to be talking about ergonomics. Jenny is a clinical assistant professor and director of the abdominal hernia program at the University of Michigan. And we especially want to thank Jenny because she filled in last minute for someone who couldn't make it. So thank you so much, Jenny, for filling in.
Yeah, of course. Thank you guys so much for having me and for inviting me to give this talk. So I think my most relevant disclosure is I'm actually on the board of directors and I'm a committee chair for the Society of Surgical Ergonomics. So I'm going to be talking a little bit about what ergonomics is with a specific focus on hernia surgery, and then talking about some techniques that hopefully will be helpful for the surgeons in the room in terms of optimizing open surgery, laparoscopic and robotic surgery setup, and then some other tips and tricks to enhance wellness, which I think a lot of the other speakers have gone through today. So first off, what is ergonomics? So for those of you in the room who, if this is a completely new topic, ergonomics is really the study of human efficiency in their workplace. And as surgeons, when we talk about surgical ergonomics, it's really the scientific discipline that is concerned with the understanding of interactions between surgeons and their surgical environment. I think this is a topic that, has really become more relevant in the last couple of years and something we're paying more attention to with the risk of musculoskeletal injury, burnout, and some of the other things that the other speakers have talked about in this session. So ultimately, the goal of improving surgical ergonomics is to improve function, satisfaction, safety, efficacy, and surgeon productivity. And I guess, the question is like, why do we care about this? Like, why is this something that we keep talking about? And I think like my biggest disclosure is I love operating and I hope to be able to continue my career for a very long time. But oftentimes I think we find ourselves in awkward like positions in the operating room. I think we're so busy taking care of our patients that we really forget to take care of ourselves. And most of the time when you get into these awkward positions, it's unrecognized. And then over time, this can lead to musculoskeletal pain and then ultimately disability and injury. So I think most of the time we think we look like this. But we actually look like this for extended periods of time. So I don't know if, like when you're doing your TARS, you're really trying to look in that plane. You're trying to look over the table when you're teaching your trainee. You're trying to make sure that they're in the right plane. And so sometimes, we put ourselves in these uncomfortable situations and we don't even realize that we're doing it until the end of like a 3-hour case. And so I think the problem is actually very prevalent. So when you look at meta-analyses and studies, and so this is a study looking at 21 different articles, close to 6,000 physicians, most of whom are surgeons and procedural interventionalists, you can see that the overall career prevalence of degenerative lumbar spine disease is about 19%, rotator cuff pathology is 18%, and a 12-month prevalence of neck pain, shoulder pain, and back pain is really high. It's over 50% in most of the surgeons that were surveyed. And so ultimately, 1 in 5 proceduralists will end up having some sort of degenerative lumbar spine disease, and almost 12% of proceduralists will require leave of absence or face early retirement as a direct result of these musculoskeletal injuries. And so I think that brings me to my next point, is, well, then how can we make surgery better? And so I think there's many different ways to think about optimizing open surgery. And so much of that has to do with how we set up our operating rooms and being very intentional. Sometimes you can even think about doing an ergonomics timeout at the beginning. I always try to check in with the trainee or the medical student that I'm operating with and make sure that when we set up the room, it's comfortable for everybody. So some things that you can do for open surgery, make sure you're adjusting the table for the tallest person. Sometimes we always adjust it for the attending, but it probably should be for the tallest person that is standing at the table. You have to be really careful of wearing loops and headlights, especially lead. Those are all things that can add additional weight to your cervical spine and your back that can also lead to injury if you're wearing it for long periods of time, especially over numbers of days. Think about using lighted retractors instead and consider, how much neck flexion you're actually doing during all of these cases. Other things are thinking about having good posture, having a neutral spine, consideration of your pelvic tilt. And so you really want to maintain your weight and distribute it evenly through both legs to decrease strain on the lumbar spine. And I think there's also a lot of evidence for something called micro breaks in the operating room. So this is a really interesting multi-center institutional study that was done by Adrian Park's group, where they looked at surgeons and groups where they impacted micro breaks, and they found that micro breaks actually improved surgeon post-procedural pain. Operative duration did not differ, meaning people didn't end up spending longer times in the operating room just because they took micro breaks. And there was improved pain scores for surgeons for both laparoscopic and open procedures. So with that, I know we've all been kind of sitting for close to an hour now. So if everyone wants to stand up and maybe do like a micro break stretch with me, let's do it. Come on, stand up, get up, get up. This is interactive. All
Stand
right,
in
so
base
I don't know if you
position.
guys can play it in the back or if you can hear it.
Deep breath in,
So we're all gonna take a deep
and
breath
out.
in and out.
Shrug shoulders up, then
Shoulders up.
back, then down, keeping your chest up. Arms shoulder height, palms facing chest. Reach forward and follow with your shoulders. Return hands to your chest. Flip hands over and reach forward again. Return hands to chest and back to base position. Lift face towards ceiling and drop head back. Breathe in. Now release breath and return to base position. Tuck chin to your chest and continue curling forward. Return to base position. Right foot forward. Look over your right shoulder and continue turning your shoulders. Return to facing forward. Side bend to the left. Return to upright. Left foot forward. Look over your left shoulder and continue turning your shoulders. Return to facing forward. Side bend to the right. Relax and return to the base position. Pinch buttocks together and gently arch your low back. Relax and return to the base position. Pinch buttocks together and do an abdominal crunch. Return to base position. And finish with deep breath in and out.
That was easy, right? So you can do that while staying sterile and scrubbed in the operating room. There's actually a web app if you want to set a timer, but sometimes it's nice to do a timeout at the beginning and say, hey, we're going to take a break, every hour and a half, every hour, and do a mini break. It really kind of helps recenter and focus. I find that during cases, I like to do it during certain parts of the case where I know that I'm going to be taking a break or changing my gloves and doing some of that. So we talked a little bit about open surgery, but I think, this ergonomic problem also impacts minimally invasive surgeons, especially minimally invasive hernia surgeons. Dr. Park also wrote this really interesting article about how laparoscopic surgeon can really benefit the patients, but surgeons tend to suffer a little bit more. And so when you look at the meta-analyses for specifically minimally invasive surgeons, of note, this does not break down laparoscopic versus robotic. Minimally invasive surgeons had higher odds ratios for pain in the neck, shoulders, hands, and legs, fatigue, and numbness compared to people who did open surgery. And so I think in terms of laparoscopy, there's a lot of other things that we can do too. So I think this involves, positioning your monitor at the eye level, making sure your table height is lowered, because most of the time when we're operating laparoscopically, it's a little bit different than open surgery, and then keeping your arms and elbows at like 45 or 60 degrees. I know we have a lot of trainees that kind of hunch and look like this, and then you're like, wait, do you need the table height down? Do you need it rotated towards you? So even just being mindful of who the operating surgeon is and how you can help them. There's been a lot of talk about if robotic surgery can potentially improve surgeon ergonomics, and I think that's true for large muscle groups. But I think if we're not careful with robotic surgery, that can also lead to musculoskeletal pain. So in this survey of over 400 robotic surgeons, you can see that robotic surgeons also report physical symptoms and discomfort, especially with neck stiffness, if you're looking into the viewfinder, and potentially finger fatigue and wrist fatigue. And I love this survey because there's a question in there that says, how do you attempt to minimize these symptoms? And 36% of surgeons say they just ignore the problem, which sounds like us. And so I'd say that robotic surgery is probably better in certain ways, but I think at the end of the day, awkward positioning can happen during any kind of operation. Like how many times do you see your trainee like not clutching and they're like this the whole time? So I think most of the time, because we don't recognize it, that's when injuries can happen. And so I think having that increased and heightened sense of awareness can definitely help. And so specifically for robotic surgery, I think certain things that you can do is making sure you're adjusting your chair height, making sure it's got lumbar support and wheels that lock. Looking at the viewfinder, the armrest height, the console finder, and then the viewfinder tilt, making sure your foot pedals can reach. And then you can see here from this graphic that these are kind of the optimal angles that you want to achieve for robotic surgery. And some additional tips that I provide my residents is you want to make sure you adjust your ergonomic settings every single time, even though they're stored, because your chair height can change every single time. Maybe you're wearing different shoes. Some things are just a little bit different. And also, like, I just make sure that I'm comfortable every single time, even if I'm sitting down in between cases. Who knows? Like, maybe one day you're more tired than others, and maybe you're slouching a little bit more. And so I think it's very important to just have that increased awareness. And also make sure you take micro breaks and hand stretches and finger stretches. I've noticed a lot of people have described potentially more wrist pain from some of the rotation movements from robotic surgery, so that can be important as well. And so I think, change really starts with surgical culture change, right? Increasing that awareness and realizing that these are things that we can do to optimize ourselves. When we're in the operating room, we can create that culture. We can partner with industry. We can do a lot of different things to help bring awareness to this. And also, as surgeons, we also spend a lot of time outside of the operating room. So when you're in a clinic setting, I think these are all things that we can be aware of too, is even when you're on your computer at your desk, thinking about ergonomic sitting, positioning, do you have a standing desk? All of these can really impact your day-to-day health. So some final thoughts. I think increasing awareness and recognition that ergonomics is key, is going to be key in injury prevention. I think there's going to be a lot of potential easy implementation, things that you can do in the operating room just to make your daily life better. And then I think healthy surgeons and surgeon wellness starts inside and outside of the OR. Thank you so much.
Thank you. Thank you, Jenny. If we can have all our speakers come up for a Q&A session. And while our speakers are coming up, I want to ask the members of the audience, let's say you are having an operation, you're the 7:30 case, and you find out that your surgeon has been up all night long operating. So they're going to come and do your operation after they haven't slept at all. How many people would be happy or comfortable that their surgeon has been up all night long before they operate on you? Anyone? How many people would want their surgeons to get a full night's sleep before they operate on you? I think all of us, right? So, but then we're constantly in situations where we need to operate on patients after we haven't slept. So I think that's a big system problem that we need to address as a group. Let's start, David.
Yeah, so first of all, thank you to Laura and Chip for organizing and making this session happen. I want to congratulate every single one of the presenters. I enjoyed your stuff. I feel like I'm at an Alcoholic Anonymous group. I'm David. I screwed up my whole life. I've been here for 60 years and I haven't slept enough in any of that time. I don't exercise. I eat like shit. I'm just guilty of violating every one of your lectures. And I'm most guilty of not passing those, Brian said, foundational behavior patterns onto my children and emphasizing that. And so again, thank you for increasing this awareness, and we need to keep doing things like this and taking care of ourselves. So my question to start the process is, I'll start with Knut, but happy to have anybody answers. In the context of professional athletes and comparing that to surgeons and how society expectations and how our individual expectations, what are your thoughts on similarities and differences?
That's a big question, David. First, the life as a professional sport athlete is extremely egocentric because everything you do is about your performance. So everyone else has to adapt to you. When we work in the hospital, we have to adapt to the shifts, our patients. So I would say that might be the biggest difference, that as an athlete, you can focus extremely much on yourself, whereas in surgery, we strain ourselves so much for our patients and to adapt, and that might be a very detrimental effect on our health.
But to your point, I do think surgeons are athletes in a way that, and I don't think we have a good formal training mechanism. I think Talar's written, an article about this too, where I think we should be more intentional about how we're training. I mean, we're here at an abdominal wall conference, we're talking about core strength, but we're not talking about what exercises that we should be doing to strengthen our own cores before we have core injuries. And I think all of these things can impact our health. So I think easy things, key takeaways for anybody here at the session would be number one, if you do go work out. I think even something really simple like stretching can make a big difference, right? In terms of pain, in terms of flexibility. These are all simple things you can do. If you're sitting in your office between cases, it's really easy to, maybe take a mini stretch break or to do some core exercises, to do something, and then just kind of being mindful of all those things. I think the hardest part for all of us is finding the time to do it all. But I think as the panelists have all cited, it's really important that we take care of ourselves too.
Yeah, it's so hypocritical, Jenny. I agree with what you're saying, that I feel so hypocritical that we have such high expectations and we place surgeons and patients' lives in our hands, and yet we don't treat ourselves even as a high school athlete might get treated and provided resources and what you're doing and have been doing for years now, and I'll to Laura address this to you. We need to change that.
Yeah,
So
and-
thank you.
And studies have shown that if you do small bits of exercise throughout the day, 2 minutes here, 3 minutes there, whether you have OR delays or a patient is late in clinic or something, that actually can equal doing like a full half hour. So it's not a bad thing to do tiny little exercises throughout the day. You don't need, a full half hour or 1 hour if you don't have time that day. You can do it in small bits.
Thank you so much for this session. I think it's so important, and maybe if we keep talking about it, it will get more and more into your minds, because it's really hard to do all this. Even at small amounts, it's so hard with our lives. Everybody was fantastic. Regarding mindfulness, I think mindfulness is very important in our lives. And one of the things that I want to share is that in the beginning of my workday, I used to take care when the kids were little, take care of the kids. And then I thought I was in control if I was during the whole journey to work, thinking about the things I was going to do, because that way I would be prepared when I got there. And the last years, what I found out, I was completely wrong. So I go to work being mindfulness, look at the cars, look at the sky, look at everything that's going around you. It's not about meditation, it's about being present. So when I get to work, I'm in a state of mood that I'm ready to my work, but completely aware, not just in that state of mind that I used to be, because I was thinking about work, and sometimes I didn't even know how I get to work because I was thinking about the whole time. So those little moments, it helped me, and to be more organized when I got there, and to be more relaxed and everything for my team. And I hope it helps you too.
If I may add, you cannot look after patients, you cannot look after your loved ones if you have an empty cup. And you first of all need to look after yourself. You need to have a ritual of focusing, recentering yourself, and exercising, and then you will be able to look after the others. Yeah, you put your oxygen mask first before you put the oxygen mask on, before you help your children. And this is something that we often forget about. I've lost in the last 5 years, 5 of my dearest colleagues from medical school. All of them committed suicide. 4 of them were surgeons, 1 of them was an anesthetist. We were not told how to cope with this pressure. The only way to be able to get over this kind of situations is it's about acknowledging it, but trying to make something, trying to help yourself. Yeah, and help is there. You just need to find it. Talking to someone close to you can help. Talking to one of your mentors, talking to one of your best friends can help. But you need to acknowledge first that there is a problem. And that's what we sometimes forget to do.
I'd like to continue on your question, David. So in sports, the entire culture is built around the athletes to make them perform. So just to ask the audience, how many of your departments have a mental coach or a performance coach that you can talk to that asks you how you're doing or how you think you can improve? None of you have it, right? It's almost unheard of in surgery. All the soccer clubs now have at least one or several performance coaches. And I think we as surgeons, we need to start building that culture where we try to look at ourselves as top athletes and adjust all we can to improve our well-being and mental health and strength.
I just wanted to thank all the panelists. When I was putting this meeting together, was thinking about all the different sessions, and I think we were at lunch together, Jenny and Sabrina and I think Jenny and Sabrina brought up, they said, you know, we're kind of normalizing some of these crazy habits of like staying out late, drinking too much and operating at 3 a.m. And they said, you know, like it's really not good for like the young surgeons to see that that's okay. And I kind of thought, you know, you're absolutely right. We need to, and, you know, getting away from Halsted because, you know, those were like the old surgery times. And then tying into what Newt is saying, at least like in my hospital, like you're like the least important person as the surgeon in the operating room. You feel like if you say anything, you're going to get written up. So, I mean, I had a scrub tech dancing the other day. I see her dancing and I'm looking at the elbow. It was a horrible case. And I said, do you mind just stopping dancing? Like I can, you know, she's not going to be dancing in Hennifer's room, but she'll dance in mine because she doesn't care. She's not going to, you know. And I'm just like, and then I'm like, I'm sorry, I'm just miserable. Like I'm trying. And then she's like, I'm so sorry you're miserable. I'm so sorry you're miserable. And I'm like, this is like horrible. It's like abusive because you should be the athlete in that room. And they realize, you know, you are twisting yourself uncomfortably. You are sweating, you know, this patient depends on you having like the full like performance, having a good night of sleep, not being stressed out. This, you know, live human being that's under anesthesia depends on you and nobody really cares. So I really hope that, you know, we take sessions like this to the rest of the meetings and we write about this kind of stuff. You know, we need to focus on the person that's holding the knife instead of all these like fuzzy things. Oh, let's, you know, even like the smoke evacuator, like I'm a big proponent of that because I do all these huge paniclectomies. And I know there are a lot of plastic surgeons who've gotten lung cancer, never smoked a cigarette in their life, but from all the smoke. And it's just, we can't even get good smoke evacuators because, you know, nobody really truly cares about us inhaling that. So anyway, I mean, I'm getting old, but I'm hoping that there's some young people who want to write about this and popularize this because it's really important. So thank you guys so much again.
Before we wrap up, we're going to put each one of them on the spot again and ask who's down at the end. John, start with John and work our way down and have each person share one thing that they think each one of us could do on Monday that might take 2 minutes of your time that might improve your performance or wellness for the week.
So piggybacking off my topic, one thing that I think is easy to do related to sleep is I actually halfway through fellowship adjusted my sleep environment. I went out and I bought blackout curtains and I was shocked how much of a difference that really made for me. So I know it seems like a small change, but being intentional about your sleep environment for me made a big difference. So I think that's an easy fix.
I'd say call one of your friends and ask if they want to start workout with you.
3 + 3 = 6, no? 3 in, 3 stops, 6 out. Take a deep breath.
So I think it's easy to eat healthy. So you had to organize yourself, bring food with you, and be conscious about food because it's hard to avoid ice creams and these delicious things. So be conscious about your choices.
When you're in the operating room next and you're doing your surgical timeout, I would encourage you to include an ergonomic timeout. So as a part of that, I would say like, okay, so we're going to stop every hour and a half, or we're going to stop at this point in the case to do a mini stretch. I think sometimes we always talk about the physical aspects of ergonomics, but I think it's also nice to talk about the cognitive aspects too. So that way you can minimize disruptions during your case. You know, I think sometimes even setting it up with your team. So if the scrub techs have to leave or scrub out, you can say like, hey, you know, if there's changes to who's going to be in my operating room, if you could let me know, that would be great. Or I would really prefer to minimize distractions during this key part of the case. I think that can also be really important too. So just communicate with your team and set expectations, and hopefully we can hold everybody accountable.
Thank you, everyone. Thank you to our speakers. I think this was a fantastic session, and it sort of, at the very least, reminded us that we need to take care of ourselves. And hopefully we can all make some small changes on Monday and start that and keep it going, right? That's the most important thing. Thank you so much. And I think it's a little break time right now.